Hi, I'm Chris Gush. I'm the Executive Director of RCVS Knowledge. I'm here to tell you a little bit about what we do, but also to introduce the next speaker as we asked her to do the piece of work that sits behind the presentation. So, can I have a show of hands? Who's heard of RCVS Knowledge? Well, that's good to hear. That's good to see, even. So our aim, I suppose our remit is to help advance the quality of veterinary care for the benefit of animals, the public and society. And we do that through a number of ways. We do that through trying to get a greater use of evidence-based veterinary medicine and also drive quality improvement within the profession. So I'll just go through some of the possible resources that you can use. All of them bar one are free. So and all of them require people's engagement, but also support to us with your knowledge as well and to share. So the first thing that I wanted to talk about was our journal, Veterinary Evidence, and that is where Laurie's presentation and a little bit comes into, because we commissioned the work to be published in Veterinary Evidence. And this is an open access journal online that's free to publish in, mainly deals with critically appraised topics, but also looks at especially commissioned articles as well. This is one on cruise ship surgery, but it covers the breadth of the profession more widely. You can, if you Google veterinary evidence, it'll come up, and you can have a look at those. We also provide a free email resource, which is a journal watch. So we have a group of vets and our library team go through the literature over the last couple of months. They look at the journals and the articles they feel have the most impact to the profession. They are then written up, and any caveats are included, looking at population sizes, looking at the demographics that were looked at, to make sure that people get a full understanding of what that article would mean. So if you haven't got time to read the huge amount of literature that is out there at the moment, then this is a good place to start to get the ones that might have the biggest impact in practice. This is the latest one, I think has just been released. We also have a library service, so this is where the payment comes in. It's not that expensive. It's £130 for a vet, £55 for a vet nurse, and we provide support. We provide access to the journals, to the full veterinary journals. But also we provide support for library members who want to do some searching and actually find the answers to some questions. So here's an example of searching that you can do on the internet around mammary tumours, dogs and spaying, and you'll get nearly 400,000 results on Google, which may take a while to go through. But with the support of the library team, you can get that down to a more relevant 25, and that's a much more useful number. The other thing I was going to talk about was our work around quality improvement. So quality improvement fits in quite well with evidence-based veterinary medicine, how you do it. So where's the evidence? And then, are you doing these things correctly? So what are you doing? And we're trying to push on both axes. So we provide an awful lot of resources around quality improvement. So you've got walkthroughs around step-by-step, through step-by-step activities and techniques. So those techniques include development of practice-based guidelines, checklists, clinical audit. If you don't know where to start, we've got e-learning courses for it, case examples, so how other people have taken these things on board and how they're using them and the outcomes on them. And also where you can input some data to benchmark, so especially around small animal surgery. We'll talk about that in a second. And then a bit more kind of resources around the development of learning cultures and some thinking around that within the practices. So, for example, checklists. Here's a checklist that Animal Health Trust allowed us to use around, and I'm sure many people are using the surgical safety checklists that are available. A recent innovation, early 2000s for the WHO, and there's evidence, at least in human healthcare, and recent evidence that the use of these checklists are cutting death by 22%. So if you could buy a widget that would reduce deaths by 22%, I'm sure you would. This isn't a widget, it's a piece of paper, it's a lot cheaper. So implementation of it in the practice can be a challenge, but I would get going on that if you're not already doing it. Here's some data that we've got from our benchmarking. So this is our complications of neutering audit that's been running for a number of years. This is reasonably old data at the moment. We are in the process of looking at the current stuff, but you can see that from the 30-odd thousand surgeries that we've got records on, 25% of those had an abnormality after a routine neutering. So, I mean, I'll leave you to make your own judgments about that. But of those 25%, you can see here the ones that actually required some sort of intervention, further intervention by the vet. So this data's been pretty stable for 10 years. So it's something that we're looking at and trying to support the profession to drive those numbers down and make it a little bit better reading. The next release around collection of data will be around canine cruciates. This is going to be released in the new year. So if anybody's interested in submitting information around that for us, then the email address, the web link is here, and that will provide data back to you as an individual practitioner and also comparators against where you are at a national picture. Identifiable information won't be available to us or anybody else, so you'll be able to see where you are against other people, but no one else will be able to see which one you are, so to speak. I was going to go through a bit of the history stuff we do. We look after the archive of the college and also the profession more widely. We're the largest digital collection of veterinary literature and archives in the world. If you go to Google Vet History, you'll come up. It's really quite fascinating stuff. It's an add-on to the work that Knowledge does, but quite fundamental. We've got letters here to the college signed by a famous gentleman called Lister. We've also got, quite interestingly, Aileen Cust's registration, the first female veterinary surgeon to be recognised by the college, and you can see here they had to make a little change to what they were usually doing. So again, quite interesting. We also come across an awful lot of amazing artwork that we're not quite sure what it is. So we have a What's It Wednesday, and if you follow us on Instagram, you can help us identify what the sometimes quite gruesome but beautiful artwork is. So we have a few here. I mean, that's an eye, but the rest of it, you know, is up to you. So there's the Instagram post. So thank you very much for listening to my brief overview there. I'd like to now introduce Laurie Teller. Laurie is a clinical associate professor of telehealth at Texas A&M, University College of Veterinary Medicine. We commissioned Laurie to talk about the kind of literature around telemedicine and the potential impact. So, Laurie.
Howdy. I bring you greetings from Texas in the United States, and thank you to the RCVS for inviting me to do this literature review for you. It's just a sneak peek. The first draft was just completed. The librarians are doing some editorial review of it, and then we will be submitting it for the actual peer review process. So I do want you to know the gist of what I'm going to tell you, I think, will be accurately reflected in the literature review, but what I tell you right now has not gone through that process. So a lot, I think, of this was triggered by the RCVS summary analysis that was done last year. I know y'all have had big debates on what y'all call undercare and prescribing of medication, and you've just started your consultation on what telemedicine should look like in the UK. You are not the only country struggling with this. This is all over the place in the United States. What you call undercare, we call the veterinary client-patient relationship. Canada is also grappling with this, and I was recently contacted by Australia to help them sort through this as well. So this is a global issue, trying to master what to do with telemedicine. For the literature review, I read through almost 200 articles. This constituted journal articles, veterinary news magazines, conference proceedings, thesis papers by 100 unique individual authors. The span of those articles was 1981 through 2019. The vast majority were 2001 to 2019, and 84 of them were published since 2012. The actual search for the articles was done by a PhD librarian. Otherwise, it would not be pretty if I was doing it. There was a lot of literature, so this is just a sampling of some of the journals that I read. As you can see, they also span the globe. The only country that did not have some kind of article printed on telemedicine was Antarctica. So teleconsulting, y'all are familiar with this. This is vet to vet. There is actually strong evidence to support the continued use of doing teleconsultations, not only with other veterinarians, but even with other experts. Just some sampling of the articles. Patients Without Borders was a project done between Tufts and an equine facility in Morocco. They used both synchronous and asynchronous telemedicine, meaning real-time and store and forward. Veterinary teleradiology, which y'all had a robust discussion about with the fellow from NHS, still a really big deal. And AI is impacting that as well. Paraprofessionals in Africa, so it's not just necessarily veterinarian to veterinarian, but in areas where they really don't have veterinary care, it may be the paraprofessionals that are using telemedicine for consults. And then finally, just this past August, real-time telehealth using ultrasound technology remotely had positive impacts on equine health. So some of what came out of some of these journals, the first one is the equine article that was just published in August. Not only was there clinically useful information, but it proved there was reassurance to practitioners and horse owners and provided education to practitioners. The clinical technology in small animal practice, the most important influence of telemedicine is that it completely changed the way the man was practicing. He was able to elevate his practice from being just a shotgun drive-by approach to actually focusing on what each patient needed and be able to work with others to enhance that care. Y'all are familiar also with veterinary pathology, similar to veterinary radiology. This is when you can transfer images of cytology slides to a pathologist to read out. What is new in this area is whole slide imaging. So much like when you used to pack it in the mailers and actually send it to the pathologist and then wait 7-10 days to get a report back, instead of just trying to line up your phone and snap a picture through the microscope, you can now scan the entire slide and send that. And that has rapidly increased and improved the turnaround time on reading these slides, and it has been shown to be just as effective as reading the actual slide. Something else is that veterinary consults may be good for the soul. Y'all, just like us in the US, are grappling with well-being issues. And so there is some evidence that teleconsults are actually improving veterinary well-being. This came from that equine article. This is a peer-reviewed study. And so you will notice that the veterinarians considered 20% of the interactions to be educational. So they were actually learning from it. And 40% of the veterinarians felt reassured by the knowledge they were getting from the expert ultrasonographer. This is from an avian veterinarian. This is from a roundtable discussion, so it's not necessarily peer-reviewed, but he is servicing parts of Alaska. He is based in California, and they are just not the resources there for some of the bird and exotic medicines that may be needed. And he goes on to comment that some of the people he was working with should just go ahead and take the board because what they were doing was at such a high level, but they really needed help from him in that reassurance. This came from y'all's own Vet Times earlier this year, also to the benefits of mentoring. One of the cases cited in this article was a solo practitioner late at night was presented with a sled dog in dystocia, pregnant with 7 dogs. She did not know how to handle this. She reached out to a specialist in this area who went on to walk her through the necessary steps, and she was able to deliver all 7 puppies to go on and be healthy and survive. This is from a food animal practitioner in Texas, and he is in a rural area, and he's working with other rural veterinarians through teleconsulting. Frequently, these are younger veterinarians in a rural area who are on their own, because that's what it is in a rural area, and he is able to help them feel better about the decisions they are making, guide them through appropriate decision making, and really increase the scope and sophistication of what they are doing. So just a summary of what teleconsultation can do for you. This is a program that we are doing at Texas A&M as well. So it's certainly helpful for triage. When necessary, early referral can improve outcomes. Or on the reverse side, it can also let you know referral really isn't necessary. Supporting recent grads or more experienced DVMs with an unusual case. And also it can help you just be a part of a team. We're seeing that the primary care veterinarian, the specialist, and the client all work as a team, and the client can appreciate the value of the teleconsultation. Telemedicine, direct to consumer. This is where everybody has a lot of angst. There is certainly not as much evidence base in this area, partly because of the restrictions on the under care or VCPR laws, but we are seeing some more. In JAVMA last year, the Journal of the AVMA, they did do a random sorted trial, sorted clients post-op rechecks. Either they had a virtual visit recheck or they came back to the clinic. They didn't get to pick which one they had, but they could certainly decline if they didn't want to participate. And they actually showed that the clients who utilized the virtual visits, that their dogs were less fearful of how the process went than if they'd had to bring them back to the clinic 7 to 14 days post-op. For a long time, Tufts has been doing behavioral work direct to consumer through their website. This actually started long enough ago that it was a fax-based service. Lots and lots of good results, not only treating canine separation anxiety, but also dog aggression. And finally, it's an interesting example, but it does do a great job showing what direct-to-consumer telemedicine can do. A dog, a military working dog, became very ill at a remote forward base. There was no veterinarian available, not even a veterinary paraprofessional. There was some real concern about the wellness of this dog and what could be done for it on an emergent basis. So they did use a telemedicine consult to stabilize this dog. And one of the results of this, when they were in contact with the veterinarian who oversees military working dogs, when they were just verbally describing what was going on with the dog, the veterinarian really was not sure if the dog was that ill. When they were able to do a video consult, it became readily apparent that this dog needed to be evacuated. So the dog was medically evacuated to a nearer base where it could have a CT done, and the dog was also decompensating. They stabilized it and then sent it back to the base in the United States where it could finish. And one of the comments that came out of that study was that video conferencing was extremely effective and should be considered in future situations where specialist care is not immediately available and transmission of visual information would be beneficial. So I think it's important not only to recognize that telemedicine has a role, but what does that look like? What kind of telemedicine visit is appropriate for what kind of visit? I'm going to flip back to this really quickly. Kaiser Permanente is a big healthcare facility or group of facilities in the United States. Last year, they had seen more patients through telemedicine than they'd actually seen in person. From that JAVMA study, this goes back to there was decreased stress and decreased fear-related behavior in the dogs who had their post-op recheck done virtually versus in the hospital. And then, of course, the last one is from the behavior study, and it goes on to say that in-person consultations are not always feasible because of the low number, geographical location, and accessibility of qualified behaviorists. Then finally, y'all have heard a lot about this already today, but mobile health, wearables, and telehealth gadgets, there is actually a fair amount of evidence-based literature in this area as well. So just an example of some of the things we're seeing, of course, microchips that can also tell you body temperatures. In the lower left, that is actually a stethoscope that was printed on a 3D printer and is now part of an iPhone case. You're aware of the Fitbit, the other wearables, lots of wireless EKG devices, ways to measure blood glucose without having to stick the cat multiple times a day. Owners can use the Freestyle Libre at home. This is also just to show you what an ophthalmologist can do, or what kind of pictures can be taken and sent to the ophthalmologist. In the upper left, that little band around the iPhone camera, that costs $10. That allows you to get a macro picture of the eye, and what you're looking at below that is the fundus of an alpaca. So that's pretty cool, what you can just do with an iPhone. The WhisperSync stethoscopes to diagnose bovine respiratory disease, the head halter on the horse that takes a continuous EEG to monitor both activity and seizure activity, and then just EKGs that you can get with your iPhone. Those have been validated in horses and dogs. So pediatrics. So since there's not a whole lot of information on telemedicine direct-to-consumer in the veterinary world, the closest comparison that everybody likes to bring up is pediatrics on the human side. And some of you may be familiar with the American Telemedicine Association's guidelines that they did in conjunction with the American Academy of Pediatrics. And in the guidelines, there's a statement that says that children under 2 years of age should not have their parent or guardian utilize telemedicine for their care. And that was being cited at some of the veterinary meetings as a reason why we should not be using it in veterinary medicine. So we reached out to the chair of that committee that wrote the guidelines, and he was truly actually horrified that we were using the animal's inability to communicate as a reason for not utilizing telemedicine, because that was not the reason why that statement came out in the guidelines. And he went on to point out that it's not just infants that have communication ability problems with people with autism, other nonverbal disorders, they cannot communicate either. And so that would not be a reason to not use telehealth. And he went on to say that we should be using telemedicine to intervene early and leverage the continuum of care provided. So what does it say in the pediatric journals? Well, that it can be used for a more informed decision making, that documentation should be the same as for a face-to-face visit, that a lot of the negligence cases on the pediatric side have involved telemedicine providers who prescribe medication across state lines without examining the patient. So that is something that we as veterinarians can learn from. They have also found that it was reliable. They did 2 different studies, one in assessing telemedicine for children with high fevers. That study started from 0 years of age, so infants all the way up to 18, and children with respiratory disease, and that went up to kids that were 13 years old. And they showed that telemedicine was as reliable in diagnosing those cases as it was as bedside consults. And then finally, another place that we can definitely learn from our human colleagues is the treatment of acute respiratory illnesses. Children or parents who did a telemedicine visit on behalf of their children, the child was much more likely to receive antibiotics through a telemedicine visit than they were if they presented to an urgent care center or if they had gone to their pediatrician's office. So again, something for us to learn from our human counterparts. This was one of my favorite quotes out of everything I read. This was from a letter to the editor about the boffins. The conclusion is that telemedicine is not something abstruse and only for the boffins. It is useful and simple to use even today. It can only get better and its use become more widespread. I don't know how many of you study World War II history, but the boffins were the backroom guys, the techno geeks that were doing all the planning in the back room. So they got the nickname of the boffins for being technology savvy, and to use telemedicine, you do not need to be. And that's it. And I think that's the #1 reason for telemedicine. It's Dr. Google. So anyway, overall, the literature does support its use with some caution. I think we have reasons to be optimistic about it. And again, when the article completes its peer review process and is published, y'all can decide for yourselves.